Alright guys, so this is part 3 of my birth plan. If you saw part 1 and 2, it was basically going over my, where is it? This is the same thing. My essay. This explains, the reason why I'm doing it in this order is so this will explain why I chose what I did for my birth plan. This video is going to focus on my birth plan itself, but I also want to start off by stating that my mom's experience with her children. So you guys know I'm not just completely full of shit. I'm not one of those granola moms. I'm not like one of those moms that is afraid of everything. But my mom actually ended up having to have a C-section with me due to, and I was early. I believe I was born. She started going into labor at 25 weeks. They were able to keep me in for a little bit longer, and due to a placental abruption, which means that the placenta detached from the uterus. So they told her, they were like, you and the baby are not going to live through the night, because she was bleeding. She was bleeding out, and then I was losing my blood supply and oxygen. They managed to get that to stop. They put her on bed rest for a few more weeks. I think my mom said I was born around 30-something weeks. Maybe like the same time Silas was born, 32 weeks. So I was in the NICU for a little bit. But she had to have a C-section. I don't know why she had to have a C-section. Honestly, I think it was because of, that's actually a good question. I don't know why they talked her into having a C-section. Actually, it was probably because, no, I know exactly why it is. Sorry, backtracking. She had to have a C-section because she was not in labor. The placenta was just detaching from the uterus, which means, well, I explained it to you, but she wasn't in labor. She wasn't contracting. She wasn't dilated. So if they didn't get me out fast enough, I was going to die. So those are the cases in which a C-section is medically necessary. She had no choice. I was her first child, so she had a C-section the first time around. Now the second time around, she had the same doctor with all 3 of her pregnancies. They didn't tell her that she shouldn't, because this wasn't a thing. They didn't realize it back then, but they allowed her to have a vaginal birth. And they didn't tell her, hey, you should probably really think about having another C-section because you've already had one previously. You're going to be at risk for rupture and all these other things with a vaginal birth. No, she wasn't supposed to have a vaginal birth after a C-section, but she did. And she went in there. My brother was like 2 weeks. Sorry, my boss is messaging me. What was I saying? I'm so sorry. I'm so spaced out right now. So yeah, so my brother was 2 weeks late. He was 2 weeks past his due date. And a lot of people think that pregnancy is 40 weeks. A pregnancy can go up to 42 weeks. But in America, they're, past the due date that we gave you, so you're late. When there are already flaws in the due date system, there's no way of telling exactly when a woman ovulated, exactly when the baby, like the egg, was fertilized. There's no way to tell that. The due date is just an estimation. So to say that the baby is 2 weeks late, he probably wasn't 2 weeks late. He was probably just measuring. He was a big baby. Normally, your second baby is bigger than your first. So anyways, she's over there having a vaginal birth, and they give her Pitocin. They induce her because she's 2 weeks late, and she hasn't gone into labor on her own. 2 weeks late. And she hasn't gone into labor on her own. So they give her Pitocin to induce labor. The Pitocin starts causing contractions, but her cervix is not dilating. The contractions are so bad that she gets an epidural. Now, this is before they had the catheterization epidural, which is where they put the catheter in your spine, and you have the button. The patient, the mother, has a button that will constantly release epidural. You will have a constant flow of the actual epidural. This was back then, before they had that. So it was injection after injection after injection. My mom had an epidural. She starts to feel a little bit better. The contractions start she doesn't feel the contractions. But then the contractions start to slow down. Labor starts to slow down, and they're like, oh, we need to up your Pitocin. Well, the epidural, like I mentioned in my essay, completely counteracted with the Pitocin, caused the Pitocin to stop working. So then the Pitocin, they gave her a second round of Pitocin, which then counteracted with the epidural. The epidural starts wearing off. My mom had two epidurals and 2 Pitocins. By that, 2 doses of Pitocin. By that time, she was basically asleep. She had to have oxygen while delivering my brother. She was asleep during his birth and didn't remember anything because of all the drugs that they gave her. Because my mom had a vaginal birth after a C-section, she is now experiencing bladder prolapse. And she had a bunch of other problems with that whole entire area down there. It completely weakened her pelvic floor muscles and everything. So this is true. This is not made up. This has happened before. On to my birth plan. Okay. So on each page of my birth plan, I included my name and date of birth so there wasn't confusion. I basically made it look like a medical document, and I put today's date at the bottom with signature line. So I put, this is the visitor page. The following visitors or persons are allowed in the hospital room and to accompany and assist the patient the whole time before, during, and after birth. Forrest, which is my husband, and Jennifer, which is my mom. The only 2 people allowed to be in the room the entire time. And then I put the following persons or visitors that are allowed in the hospital room only before and after birth. Limit to 2 visitors at a time after birth and 1 before birth. In addition to the patient's mother and husband are Amanda's immediate family, which would be Darren, Dylan, or Jacob, or Forrest's immediate family, which is Forrest's mom, dad, siblings, grandma, and grandpa. And these people were only allowed in the hospital room before and after birth. 1 person at a time before birth and 2 visitors at a time after birth. And these were the I did a visitor special instructions, and this was going to be handed out to each one of my visitors. I, Amanda, not going to tell you my last name, have the right to refuse visitation to anyone on the visitor list and can ask them to leave at any time. Any visitor not listed must be approved by myself or my husband, Forrest, before entering the hospital room. Prior to delivery, I will be in significant pain, uncomfortable, and moody. Visitation will be limited to 1 visitor at a time, in addition to my mother and Forrest, and will be brief unless otherwise requested. Please try to be understanding and respect my privacy at such a stressful time. After delivery, visitors may not enter the hospital room until Forrest and I have had time to bond with the baby and are rested and ready for viewing. Any visitors entering the delivery room without being invited in will be asked to leave and wait in the designated waiting areas. Any visitors may enter the delivery room at any point before, during, and after labor upon my request. So if I were to say, hey, no, I want Forrest's mom in here, they can come in. All visitors must wash their hands thoroughly with soap and water and use a hand sanitizer upon entry into the hospital room. Any visitors who smoke any form of tobacco products will be asked to refrain from taking smoke breaks while at the hospital. Oral tobacco products are acceptable for those who cannot cease tobacco use for the day of visitation. If a visitor smells of smoke, he or she will be asked to wear a hospital gown over their clothes before being allowed to hold or touch the baby. Any visitors, so please be mindful that mind-altering substances can hinder the ability to create a calm environment for the family and a safe interaction with the baby. Therefore, any visitors who are under the influence of drugs, medicinal and or recreational, to include alcohol, can be denied visitation and will be denied holding of the baby. Any visitors on prescription pain medications must disclose this information and could potentially lose visitation and baby holding privileges. Yes, I was that mother. Any visitors not expressing a demeanor other than calm and supportive will be asked to leave the delivery room and to wait in the designated waiting areas. Unruly behavior will not be tolerated, as it does not create a calm environment and only amplifies stress in the situation. Any visitors who are ill or are not feeling well will not be allowed to hold or touch the baby and will be asked to wear a mask when entering the room. We do request that you use your better judgment in this situation and try to be understanding. Visitor special instructions continued. Because of the baby's compromised immune system and our choice to administer vaccinations on a delayed schedule, Forrest and I are requesting that all visitors refrain from kissing the baby and or on or around his mouth and hands. Any visitors under the age of 12 will not be allowed to hold the baby, and it has both mine and my husband's signature line. Medical interventions. Amanda's delivery is planned as natural and vaginal. I, Amanda, do not consent to the administration of Pitocin or any labor-inducing interventions. I, Amanda, do not consent to an artificial rupture of the membranes unless the baby is in distress due to natural causes. I, Amanda, do not consent to any form of epidural or pain management. I, Amanda, do not consent to the use of any vacuum or forceps devices. I, Amanda, do not consent to an episiotomy unless the baby is too big and or stuck even after being allowed to labor naturally without interventions and it is medically necessary to get the baby out. I, Amanda, would appreciate it if the staff at, and then I list the hospital, did not try to persuade me into any of the above interventions I do not consent to. During labor and delivery, I, Amanda, would like to spend the first stages of labor in whatever position, activity I am comfortable with, standing up, lying down, walking, squatting, etc., unless either the baby or myself is labeled high risk and certain positions or activities are advised against for our safety. I would like to be allowed to labor for as long as possible without a time frame or a time limit, and do not consent to any medical interventions to speed up labor unless the baby or I are at risk, not for the sole purpose of getting us in and out of the hospital room. I would like the contractions and fetal monitoring to be continuous. A lot of moms don't like that. I wanted it to be just to ease my stress and ease my anxiety. I understand that fetal monitoring could be paused while walking about. I would like to push spontaneously in whatever position is comfortable, squatting, lying on my side, being on all fours, etc., unless either the baby or myself is labeled high risk and certain positions are advised against for our safety. And this might sound redundant, but in forms like this, where you have to be specific, if they were to do something against this birth plan, and I have it signed, and I have all of this very specific, I could have sued the hospital. I would like to push spontaneously without a time limit as long as the baby and I are not at risk. I would like to use a mirror to see the baby crown. I would like my husband to catch the baby when he comes out and be the first skin-to-skin contact he receives. I would like the umbilical cord to be cut by my husband only after it stops pulsating and turns white, meaning delayed cord clamping. Birth plan regarding C-section. In the event of a medically necessary C-section, Amanda would like to stay conscious. I would like to be given an epidural for anesthesia. And see, I know previously I was like, I want to be put under general anesthesia. But, see, your mind changes. But this is what I put. I would like to be given an epidural for anesthesia only after being offered other anesthesia options. I would like my husband to remain with me the entire time. I would like my mother to remain with me the entire time, only if I am allowed 2 guests in the operating room. And this is for my postpartum care. I would like to hold the baby immediately after delivery. I would like to breastfeed as soon as possible after delivery. I do not consent to formula feeding. Okay, so I have a typo, so that it caught me off guard. I would not like to be given the option of administering the first bath myself at home, and do not want the vernix caseosa, which is the white icky substance that they come out with, to be wiped off immediately after birth. You can look into that, but that's basically that's a protectant for their skin. And it can protect them from getting sick right after birth. It protects them from drying out. Yeah. I do not consent to the administration of eye drops or ointments. You can look that up as well. It is not medically necessary to give baby eye ointment or eye drops. It can actually cause like eye problems in the baby. There's literally no need for it. I would like the baby's medical exam and procedures to be given in my and or my husband's presence. I would like to be included in any procedures to be given to the baby, baths, medical procedures, exams, changes, etc. I would like the baby to stay in my room at all times unless a specific medical procedure exam requires him to be elsewhere. And this is postpartum continued. I would like the baby to be circumcised, and yes, my child is circumcised. Whatever, that was my choice. I would like the baby to be circumcised only after he has received his vitamin K shot, and vitamin K helps with blood clotting, so it would prevent him from bleeding out. I would like the baby's circumcision to be performed with options for analgesia, anesthesia, in the presence of myself or my husband, if possible. So I wanted it to be monitored, and I didn't want him to feel the pain. I do not consent to the administration of all vaccines at once, and would like the administration of vaccines to be on a delayed schedule. And I do not consent to the administration of the Hep B vaccination because there is no need for that. Hepatitis B vaccination, unless you live in a dirty environment, with dirty needles, you live around people who do drugs, there are dirty people touching your child, the hepatitis B vaccination is not necessary right after birth. It's just not. A lot of hospitals will give it to you so that way they can go ahead and get the first round right out of the way, but it's not necessary. My child didn't have it the first, and he is perfectly fine. I'm not sure why. Let me just make sure. Yeah, so I have 2 of these printed out. I'm also going to go into what didn't happen because my child was born at 33 weeks. So, let's see. First of all, the only person that was in the room the entire time was my husband. My mom, because he came so early, was not able to fly out here. None of Forrest's family was here. His grandparents and his dad came afterwards because they drove. They don't live that far away. So obviously the visitor special instructions I didn't even need that. So I didn't consent to Pitocin, but they gave me Pitocin without me knowing later on in the labor. They slapped it in my line, and I had no idea why my contractions all of a sudden started becoming unbearable. Whereas before, I could tolerate them, and then all of a sudden, they were literally they were lasting for they were continuous. It seemed like they were coming literally every minute, and they were lasting the entire minute. I did have to have an artificial rupture of the membrane, even though I didn't consent to it, because he was early and my water would not break on its own. They did follow my wishes when it came to epidural and pain management. They kept pushing it, though. They kept saying, are you sure you don't want the epidural? You're really going to want the epidural. I really recommend you get the epidural. Do you want, what else did they, fentanyl. They asked me if I wanted fentanyl instead. And then Versed. They also asked me if I wanted Ambien so I could get some sleep. But they were pushing the epidural pretty hard and making me feel guilty because I didn't want the epidural. But I did get pain medication after just so I could relax. They didn't end up having to use any like forceps or vacuum devices. I didn't need an episiotomy. I did tear, but that wasn't. I didn't tear in the like in my peritoneum. I tore in another area, and that was because of the doctor. So when it says, I would appreciate it if the staff at said hospital did not try to persuade me into any of the above interventions I did not consent to. They definitely tried to persuade me into getting an epidural, like I said. Let's see. I was not able to spend any stage of labor doing what I wanted. I was confined to my back. They would not let me get up to pee. They forced me to pee in a bedpan. I couldn't labor in any position that I wanted to. Again, he was very tiny, and I was laboring extremely fast, so I can understand why they didn't want me getting up, because he was so tiny, they did not want him to just fall out. They didn't want me to go to the bathroom and pee and him come out into the toilet. That's how little he was. The whole, them giving me a time frame and being allowed to labor for as long as possible, I was able to do that because he came really quickly. I was in active labor for like maybe 2 hours. I had been in labor for 26 hours, but I had only been in active labor, which is like where you're like actively progressing. You're past 4 centimeters and you're pushing for about 2 hours. And I only pushed for 10 minutes. They wouldn't allow me to push spontaneously. They told me if I felt like I needed to poop to let them know because that was the baby, and to only push when the doctor was in the room. They also were forcing me to push, which I don't understand the whole concept between like, okay, you need to push really hard for 10 seconds, but you also need to be breathing the whole time. Just try it right now. Push really hard like you're trying to take a shit, and, sorry, excuse my language, but push really hard like you're trying to take a dump for 10 seconds while breathing. It just doesn't happen. And then to do it while you're having a contraction, it's just, it's too much. It was way too much. So I actually ended up pushing when my doctor wasn't paying attention. I pushed after a contraction because I got through that pain of that contraction. I got up the energy and I pushed, and out he came. They didn't allow me to use a mirror. There was no mirror present. They did not allow Forrest to catch the baby. They did not allow him to cut the umbilical cord, and they only let the cord drain for like maybe 2 minutes. So there's that. I didn't end up needing a C-section, obviously, so that's not relevant. They didn't allow me to hold the baby immediately after delivery. Because he was so early, they wanted to make sure he was safe, which is perfectly fine. But they literally came over after they had him bundled up and everything, showed him to me. I looked at him for like maybe 3 seconds, and they took him away. They wouldn't allow me to breastfeed soon after delivery, which is understandable because he was so early. He actually had to be fed through a tube for the first week of his life. When I didn't consent to formula feeding, but they expected me to have a huge milk supply right after Silas was born, when they should know that milk doesn't come in for 3 to 5 days after you give birth. So they did end up giving him formula just to supplement and just to give him something. And they gave him donor milk as well, which I did consent to that because I preferred him having donor milk over formula. Nothing against formula feeding, because Silas formula fed for half of his first year of his life. I stopped producing milk when he was like 6 months old, and then after that he was strictly on formula. All of his medical exams and procedures were given in our presence because he was in the NICU for 5 weeks. We were allowed to give him 1 bath while he was there. They did wipe all the vernix off of him immediately, even though I did not want them to do that. Obviously, he couldn't stay in the room with me because of how early he was. And neither one of us actually wanted to watch the circumcision, so that didn't happen. But I think I know why, because this is missing a page. He didn't get the hepatitis B vaccination in the hospital. They did listen to me on that. And actually, they didn't give him any vaccinations. They gave him the vitamin K, and that was it. They didn't give him eye ointment, which is good. So they listened to me for the most part. A lot of the things they couldn't help because he was so early. But I am keeping all of this because I do plan on sticking to this for my next pregnancies. So we'll go ahead, and if you want to head on over to my next video, which would be part 4, I'm going to talk to you about my hospital bag list and what I did and did not need.